So we made a video earlier talking about how physicians truly do not grasp the value that they bring to the healthcare system. And we also talked about how they never get taught these things either. They don't get taught it during pre-med, med school, residency, fellowship, you name it. I even know a couple of attendings running around that truly don't grasp the value that they bring to the healthcare systems in which they work. And I can help them get there. I can help you get there. My name's Jay Vintage. I'm a board certified family medicine physician. I work as a hospitalist for a major university healthcare system. And I also own my own direct primary care clinic in downtown Oklahoma City. So if you want to grab a hold and control more of your destiny when it comes to working in the healthcare system, understanding your worth is step one. In order to understand your worth, I think one of the easiest first things you can do is be a little bit more intimately aware of your own billing practices. So when you're billing for services rendered, it should not be a guessing game. If you're guessing that this should be a level 2 or a level 3 versus knowing based on very clear-cut criteria, we need to actually improve that. So what we're going to do is teach people about the billing practices from a physician's perspective, not some business person's perspective, not from some like Yahoo's perspective in the billing office that sometimes doesn't quite grasp these things either. It's from people that actually do it and people that teach it and teach it pretty well. Once we get that done, we're going to actually be able to do some math together and realize how much money are you actually responsible for bringing into a hospital system. Now all of a sudden you see dollar signs. Wow, I made a hospital X number of $1 million and I got paid X number of thousands of dollars, and there's a disconnect there. And then what we do is kind of actually talk about what we can do to improve our situation. Because frankly, whether this is being more efficient or being more, having more time to spend with ourselves, our family, or even just more time to spend with our patients to give them better levels of care, you at the very least deserve that. But in order to truly grasp kind of what we are worth in our medical system, let's get started by understanding a little bit about billing and appropriate documentation. Even the documentation can leave patients with bills that absolutely cripple them financially unnecessarily, because frankly, a lot of this stuff their insurance should be covering. If you have any questions about these sorts of things, drop them below. If you are interested in other topics, drop them below. I'm Jay Vintage. I'm here to help you. Let's get work done.